Hey everyone, it's Dr. David here from El Paso Manual Physical Therapy. Thanks for joining us live. Today we're going to be answering the question, how long does it actually take to heal knee cartilage? And I've got some points, some talking points on this. I'll be taking questions live, of course, along the way. The talking points, just to give you an overview, I'm going to go into details though. We're going to cover 3 things that don't help knee cartilage heal. We're going to cover 3 things that do help knee cartilage heal, and then 3 things that might help knee cartilage heal. You might try that stuff out and see what kind of a benefits you have. Now, before I get rolling more, if you haven't subscribed already to our channel, please consider subscribing. We put out great, helpful information for your body every single week. We do these lives as well. If you're watching us in the replay, thanks for watching. You can drop a comment on here. We'll get back to it as soon as we can. And let us know that you can hear us here in the chat as well. You just type that in here, say hello, and tell us where you're from so that we know what part of the world you're coming to us from. All right, so KB Good has already commented here and said it's so kind of you to help us during your work day break. Thank you. Oh, I'm happy to do it, KB Good. You know, I do have a busy. A lot of people don't understand this. They see me on YouTube here and they think that I just do videos all day, and that's not the case. I have a full caseload of patients that I see all week long, and I have to carve out time in my schedule to do this because I love doing it. I love being able to help out people anywhere that I can. Anybody that'll listen. And I think that, you know, the voice that I bring as far as like avoiding surgery, medication, and injections is not a commonly talked about voice in the healthcare industry, and it needs to be out there. So that's why I'm here. New York City, awesome. Thanks, KB. Good to join us from New York City. And then somebody with looks like maybe Arabic. I can't read that language. Somebody else commented, "Hi, sir. How are you? Hello, good to see you. Thanks for coming online. I am doing good." Dee Chrysler from Topeka, Kansas. Hey, Dee. Thanks for joining us. And thank you, Mel Middlemiss. Hello, and thank you for doing this from Canada. You're welcome, Mel. I appreciate you chiming in and thanking me here. I'm very happy to do this. Oh, and you're from Saudi Arabia. Thank you so much. So it probably is Arabic. All right, so don't forget, chime in with any questions. Let's get on to this. So how long does it actually take knee cartilage to heal? Now, I've linked in the description below one of the latest articles that I found that talk about this, and it is called, let me pull it up. Here it is, mechanoadaptation. That's a big word. Articular cartilage through thick and thin. So if you want to go check out that research article, it is in the description below. It's linked in there. And it's very interesting. And it's from the UK. And these people are looking at how cartilage reacts to pressures you put on it, which is exactly what I think about all day long with my patients. And there isn't any like direct research that they did on humans. A lot of it's on animals. We haven't, to go in and take out somebody's cartilage to study it while they're alive is not something that can easily be done on research. So they do it on animals. And they found some good results. And then here in the clinic, I see people get improvements all the time. And through our YouTube channel as well, people doing our programs that we offer online, they've had tremendous benefit from implementing what we talk about here to help their cartilage, especially when it comes to like knee arthritis, like we're answering today. Now, the question of how long does it take is a loaded question, because if you look at what a textbook would say, they'll say like 3 to 6 months for cartilage healing. If you talk to your doctor, they'll say usually on the 3-month time frame for cartilage healing, because they're telling you what the book says. But here in practice, the way we see it, I think it takes longer, more like 6 to 12 months. It really depends on how severe you're injured and what body part it is as well. Because if it's a weight-bearing joint like your knee, well, it's going to take some time. Unless you can get off your legs for a while and allow that to heal, then it'll go faster. I got some questions here. Myrna Chavez. Hey, Myrna from Tucson. You're not too far away from us. It's about a 5 or 6 hour drive. I went to the Tucson Mall last summer and I had a blast. My kids had so much fun on the trampoline bungee cord thing. We had fun. And Catherine, hi, I fell on ice, direct blow to arthritic knee. Oh, I'm down for 2 months now. Please, no surgery. Yes, Catherine, you got to avoid surgery. Hopefully it will heal and you can get better. And then our Arabic viewer here, sir, knee cartilage repair is possible or not? Great question. Well, naturally, yeah, I can heal. I'm going to talk about it here just more. Surgically, there's options out there surgically as well. It just depends. And then we got Kim from Philadelphia, Pennsylvania. Hey, Kim. All right, let's get into my talking points here. So let me tell you 3 things that don't help knee cartilage heal. And these are things that are commonly told that the healthcare providers will tell their patients to do, or you might see on YouTube, on videos, you might find in books. There isn't a whole lot of research to back this stuff up, especially the third point I'm going to tell you of not to do. In fact, we've proven it that it doesn't work for the third thing. But here in the clinic, we see it all the time. Now, the number one thing that you don't want to be doing to get your knee cartilage to heal is quad strengthening exercise, quadricep strengthening exercise, strengthening the front of your thigh. It is like spelling disaster if you want your knee cartilage to heal. You don't want to get stronger. So any sort of exercises where you're having to straighten out your leg and tighten this muscle up, any sort of exercises that make these muscles right here on the front of your legs stiffen up, tighten up, and work are just not a good thing for you to be doing. And the reason is when you strengthen those muscles, here's my skeleton, they're right here on the front, it just pulls that kneecap into the thigh bone. The cartilage on the back of the kneecap and the cartilage on the end of the thigh bone right here get rubbed excessively. That's where typically people have problems. And then the tendon that connects the quads to the kneecap and the kneecap to the shin bone right here, it gets pulled as well. So it pulls the shin bone into the end of the femur, the end of the thigh bone right here, and it makes that cartilage compression just go up way higher, which is going to dehydrate your cartilage, make it more prone to injury. You're going to get tears. You're just compressing it. I mean, it's just, think of if somebody took their hand and just smashed you somehow. They just smashed the top of your hand and kept it there. You could probably take it for a while, but after days, weeks, months, years, your skin's going to break down. I mean, we know of skin breakdown happening in elderly populations. They call them skin ulcers. It's like the number one thing that hurts elderly people in nursing homes. That's why some of these people pass away too, just because their skin ulcers from excessive pressure on their skin they've gotten too bad. It'll decay the bone right under the skin on their tailbone area if they get in the right spot. So you just want to take all the pressures off your kneecap and your knee joint by not strengthening your quads. I would even say let your quads get weak. I had one patient who looked at me in the eye and she said, "So you pretty much want my quads to get weak?" And I said, "Yeah, you're in such an imbalance that it would be better for you to lose quad muscle, even though it looks good and you want it to, look good in the mirror and all that. Put on your shorts or your skirt or whatever and have nice looking thighs. But it's adding too much pressure to your knee joint and progressing your knee cartilage injuries, your arthritis, your meniscus problems. And if you can simply take that pressure off by using your quads less, then you're in a good place. You're going to be taking that pressure off. And now you can go on and walk better. You can go upstairs better. You can exercise better. You can prevent a surgery from happening. Now, the second thing that is very related is stretching your quad muscles. And I mean intense stretches, like moderate to intense stretches. And just to put it on a scale of 0 to 10, 0 is no stretch at all, and 10 is like the most intense stretch you've ever had. You're grimacing, you might get a tear that comes out, maybe even sweating a bit from stretching so hard. The reason why you should avoid quad stretches, I'm talking like these kinds of stretches right here, anything that tightens and stretches this part out in the front, is because of the stretch reflex. When you stretch too hard, there's cells inside your muscles are called the muscle spindles, and inside the tendons of those muscles called the Golgi tendon organs. Those get activated and they cause the muscle to want to contract to protect the muscle and tendon from tearing. So when you stretch intensely, you're actually exercising the muscle. So you don't want to do that. That's going to increase the pressure in the joint, just like I talked about with strengthening the quads. So you don't want to do any quad stretching. The third thing that does not help your knee cartilage, I wouldn't say it necessarily hurts it, but it really doesn't help. It's kind of a waste of time. And we know this by research. We've got tons of research articles, scientific evidence, medical research that shows that ultrasound therapy, which is A treatment that's commonly done in physical therapy offices, in chiropractic offices. You can buy the machines. I don't even own one here in the clinic because it's not really it's something that's useful for us. It's kind of a waste of time. People bill for it. Medical offices, they'll bill you for it. But we have tons of research that shows that using the machine is just as good as using the machine when it's off. They literally do research studies where they have the ultrasound wand and they're trying to do the healing stuff to make the joint or whatever, the muscle, heal faster. But the placebo, which is the same people with, or it could be a different group of people, they've done this study a tons of different ways. They use the same people, they use different people, they use the machine off, they use the machine on, they use the machine on, but without the piece that's necessary to generate the sound waves, the ultrasound waves. And they found consistently across the board that the people that go through the placebo version of the experiment get just as better as the people that get the actual treatment. So it doesn't matter. Now, if you want to do it just because it feels good and you like it, great. All the power to you. It's not supposed to hurt you, but it's not something that is really going to be the best use of your time. If you're avoiding exercising, which I'll talk about more, and you're using the ultrasound machine, you're wasting your time. Now, for those of you that don't know the ultrasound machine, it's a box. It's plugged into the wall. It uses power, and then it's got a wand. It looks like a kind of like an old telephone, like a corded telephone for those of you from the 90s and before. And it's got, you put gel, you use this little gel, and you put it on your body part, and then you put the wand on the gel on the body, and you just slowly move it in circles all throughout as you do the treatment. It's anywhere from 5 to 10 minutes. I think you can go longer. You can't stop moving because it can actually begin to burn you. So you just have to continuously move it as you do the ultrasound treatment. It is similar to what they use to do ultrasounds for pregnancy, but there's no picture generated. You're not looking inside the knee. The purpose is not to look inside the knee. It's to heat the tissues to increase blood flow. I don't know what it's supposed to do exactly. Well, we know it doesn't work. So in case your doctor prescribed it to you, because we get referrals, we get orders from doctors that say, please do ultrasound on my patient. And I go, I'm not going to do ultrasound. It's a big waste of time. And the patients will tell us, well, the doctor said you have to do ultrasound. And I'll tell them, I'm going to tell you what you need to do. You can look at our reviews. You can look, if you don't like what we're doing here, I don't want to waste your time. I don't want to waste my time. We got to do what's going to help you out. If you're okay with that, let's proceed. And it's not going to include ultrasound in your treatment. So that's what we do. All right. So that covers the 3 things that you don't need to do, that you shouldn't do to let your knee cartilage heal. Now let's talk about 3 things that you should be doing to let your knee cartilage heal. Number 1, if you've got aggravated, actively irritated cartilage, meaning it hurts now, like your knee hurts, you might even have some swelling. If you stand up too long, it gets worse right away. You can't tolerate being on your feet too long. You have an angry knee, then you need to get off that thing and do very light, unweighted exercise. I've talked about on this channel a great little exercise. It doesn't require much equipment at all. You just need a place to sit where you can dangle your feet ideally, and you just swing your legs back and forth like this, knee swings. Super easy to do, hardly any resistance at all. I mean, just the weight of your legs against itself. You should not get super tired doing this. It should feel easy to do this on your knees. You need to do lots of it though, like 5, 10, 15 minutes at a time, multiple times a day would be even better. And the purpose of this is to let that fluid inside of your knee joint move around and get in all the crevices of the knee joint. If you ever Google images of the knee joint, there's little spaces inside the knee joint where the fluid can travel. And when you move your knee nice and easy like that, that's what pushes the fluid around. Your heart that pushes blood around doesn't influence the movement of the fluid inside your knee joint. It's influenced by movement, by you moving your joint. So you've got to find some easy motion that doesn't aggravate it to be able to move the fluid around. Now, a close second would be bicycling. If it's not too irritated, using an elliptical could be done as well. The caution with bicycling is you need to have that resistance turned all the way down, and you have to make sure that you don't get your quads tired, because then you're strengthening your quads, which is something that you shouldn't do. That's very important. Let me say that again. On the bike, you should not be using your quads very much. In fact, if you feel your quads getting a workout, you need to think about using your butt muscles. You need to think about tightening your butt muscle every time you push a leg straight. So what it looks like is like this. If you're cycling like so and you push this leg straight, instead of thinking tighten this up, you got to think tighten this up to push that leg straight. So think about squeezing the butt muscle every time you push that leg away from your body. So every time you're cycling, you're alternating legs. So in this case, this leg should tighten up, then this butt should tighten up, then this glute, and you're just thinking about glute, 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 glute the whole time. And it might be a very conscious thing. Like you have to think about it the whole time that you're on the bike and think, but. And that's okay because you probably haven't ever done it like that. And you need to learn how to use your butt muscles while cycling. This isn't something that's told that physical therapists will tell people or anybody. I've never seen anybody talk to people about this stuff, but it makes an enormous difference. I've had patients that come in that love using their stationary bike at home or their outdoor bicycle. And once we get them to use their glutes properly during bike riding, now bicycling becomes a great exercise for them to help their knee joint. Versus I've had people that use the bike where they've been told to use their bike at a physical therapy clinic or they've used their own bike at home and it flares up their knee joint because they're using their quads too much. And they'll say, yeah, well, it doesn't tire me out a ton, but I feel my thigh muscles in the front warming up and working. And then later on, my knee still hurts anyway. So I don't really know if the bike's helping me. They'll have that kind of an experience. So be careful with the bike. You have to make sure that you use your glutes. So the light exercise is the point here that I was making. You need to do light exercise to help your knee cartilage when it's very flared up. Now, when it's not flared up, meaning you had cartilage damage in the past or cartilage irritation, or you've been told by a doctor that you have arthritis in your knee and your cartilage is being affected, but you actually feel okay. You're not in a flare up right now. Like it hurts if you do too much, but you can get up and move around. It's not stopping you in your tracks and you're doing everything you need to do. That's the time when the light exercise can begin to go away. You can still do it. It's going to be helpful, but you need to begin to infuse some strengthening exercises. And that's what this article that I've linked below that talks about the mechanoadaptation, what cartilage does. They look at the cells and everything. Go check out that article. Cartilage cells respond to pressures. So as long as they're not going through an inflammation process, which means they're not healthy, they're not happy. If you're feeling not swollen, you're feeling fine, you can take the pressure. Then you need to gradually pressurize your cartilage so that it can get stronger and stronger and stronger. Just think of it as skin. I lift weights, so I get calluses on my hands right here. If I stop lifting weights, my calluses go away. That's my skin's response to pressure on my skin. So I've been grabbing a barbell and I do exercises with the barbell, and the weight of the barbell tells my skin that it's going to become injured if I don't thicken it. So the skin says, well, let me send some more cells in the area to make it thicker and stronger so that next time you can pick up the same weight or more and you'll be okay. Same thing with cartilage inside our bodies. If you load it at the right amounts for the right times and you give it rest, it actually gets thicker, more dense, it has better integrity. It can heal. Now, this is different from regenerating. I need to make this point here. Cartilage regeneration is not something that is known to happen in the body naturally. That doesn't mean that you can't feel better. You can put down scar tissue. You can thicken your available cartilage tissue and be healthy and happy and continue on your way without ever having surgery. And that's a good thing. That is predictable. Rather than going to go get stem cell injections, which you can. I'm a proponent. If you want to do stem cell injections, go for it. If you got the money to do it, go for it. It just may or may not help you. It's not known to hurt you, but we don't know if it's going to help or hurt. I'm getting ahead of myself. It's one of my next points. So the third thing that is going to help you is massage. And the reason for massage is because if you've got that muscle imbalance that I'm talking about where your quads are too active, you've got to free those suckers up and let them loosen up. And getting a massage by somebody else or buying tools like this to massage your muscles out is good. I like the Theraguns that are out there. We've got videos about them. The ones that look like drills and the tip moves really fast back and forth and you run it up and down your muscles. Anything to loosen up your thigh muscles is going to be good so that it's not compressing your knee joint so much. That is good stuff. If you can loosen up your thighs with massage and then do exercise together, that is a winning combination right there. So I've got one more set of talking points. The three things that might help knee cartilage heal, but let me just go over here and answer some questions real quick. We've got lots of comments coming in. Let's see. We got Molly McGregor. Oh, Catherine says, thank you. You're welcome, Catherine. I'm happy to help. Molly McGregor says, from Northern Illinois, bone on bone, both knees. What about bone spurs are involved in there? Yeah, bone spurs are also an adaptation to too much forces in the area. Just like I was talking about calluses, bones protect themselves, and bone spurs usually happen where there's tendons or ligaments that attach to them. So for instance, on a knee here, there's tendons and ligaments all around, but like right here on the front, there's a big tendon. In kids, a big bulge can form on the tip of the knee here because the bone gets pulled. It gets pulled in this direction. And what the body does to protect itself is it lengthens and grows a little bit the bone so that it avoids snapping the tendon off. The same thing happens in other areas of the body. Bone spurs, in my opinion, are an adaptation to forces because that's how our skeleton, muscle, tendon, ligament system is built. All the cartilage as well. They adapt to forces. So if you've got a bone spur that's causing you pain, then you got an issue. Then you might need to talk to a surgeon about it. But if you have times where you feel fine, then you may be able to get on just fine with that bone spur and not ever have to worry about it. The most common bone spur that we see here in the clinic is in the foot on the heel bone right here. And we have people that go get that removed because it goes into the plantar fascia. They get plantar fasciitis and all that. And what I find is once we fix all the muscle imbalances that happen in the foot, with the bone spur still there, they feel better enough to even go jogging, exercising, doing their normal life despite having a bone spur. So I hope that helps, Molly. All right, we got T Rose Lover. I needed a partial knee replacement because of a lack of cartilage. My bones crisscrossed. Is it true you can rebuild cartilage? Because I've tried everything with calcium, collagen, MSM, magnesium, boron, bone broth, etc., and no results in rebuilding cartilage. And does stem cell work? And then you talked about having a recumbent bite as well. All right. So to answer your question, T Rose Lover, I've answered some of these already. I'm going to talk about supplements in just a minute. I'm sorry you're dealing with a knee replacement, a partial knee replacement, but hopefully your cartilage can calm down and you can get better. And then I've talked about stem cells already, so hopefully I answered your question and talk about the bike as well. All right, Catherine, posterior cruciate ligament, PCL ligament, that's a good one. An ACL injury, will I ever get better? Thank you for taking your time. So if you got a ligament injury that happened in the past, I'm interested to know, Catherine, did you get it repaired? Like, did you have surgery for this? Or you just sustained it and you moved on? That happens quite a bit. If you had it repaired, then chances are they did the repair well and your knee should be fine as far as stability. But if you just had a torn ACL and PCL, then you might have some ligamentous laxity, like some stretchiness in the ligaments that could affect the stability of your knee joint. That is not a good situation. That could definitely feed into muscle compensations, arthritis, and you need to get strength to compensate for that. Doesn't mean you need to go get a surgery for the ACL or the PCL ligaments. You can compensate with getting enough strength. And there's tons of people, there's athletes, famous athletes that have had ACL injuries and they get on just fine without surgery, win championships and that kind of stuff. I can't think of any off the top of my head, but I'm sure you could Google it and you'll find them. Wendy Benjamin, hello from Nova Scotia, Canada. Hello, Wendy. And then we got Kaushik KR, how to heal osteochondritis dissecans, stage 2. Oh, that's tough. We've got playlists on our channel for most of this stuff. We'll have to link them in the comments or in the description. I'll talk to the video editors about doing that. And then Amir just saying, I need your program, but I can't pay for it. Can you help me to have it? Oh man, you're gonna have to call our office, Amir, and see what they can do for you. K Julie 8, OA in both knees along with bone spurs, only can bend knees 90 degrees. Can anything help with loss of range of motion? Whew. How long have you had only 90 degrees of motion is my question. This is a good one for knee arthritis, especially. If you've had a loss of motion in your knee for a long time, like more than 3-6 months, If it's been more than a year, then gaining it back is tough. The longer you've had the loss of motion, the harder it is to gain it back. But there are ranges of motion that you can work with. Like if you've only lost 10 degrees or less of knee extension. So knee extension is a straight knee when you straighten out your knee. If you can still straighten it out, you're in good shape. You got a lot you can work with. But if you can't straighten it out more than about 15 degrees, like 10 to 15 degrees range, then you got problems. If you can only go to here, you're not gonna be able to walk very good. You can't straighten out your leg. If you can get to this range right here, you can walk, you can do a lot of stuff still and get around just fine. Now with bending, if you can't bend it more than 90 degrees right here, you can still do a lot of stuff, but you're going to have trouble like reaching your feet, putting on socks, shoes, um, getting in and out of tubs is a common problem that we see, getting in and out of vehicles, out of cars, riding a bike, things like that. It's going to affect exercise for sure. So if you haven't gone to try to fix it, go try first, the natural way. We got tons of videos to help with knee arthritis stretches when you have a loss of motion, when you have stiffness issues. But you've got to get more mobility in your knee and give it a good go. And if you don't have any improvements within a week or two, like I'm talking, even minor improvements, then it might be time to talk to a surgeon, and likely replacement is what they do if you have a big loss of motion like that. But if you do have improvements, then you got to keep going. It could take you some weeks, maybe even months to maximize the motion. And then you've got to determine it for yourself at that point. Are you okay with the gains in motion? Are you okay with settling at this point, possibly, which then you can make your decision. So it really is up to you. You have to do some work to get your mobility, and then you have to determine if it's enough for you. I hope that helps you out, K Julie 8. All right, I got more comments on here, but I really need to get going here. I'm going to get in trouble with my patients. I've got 3 more things that might help your knee cartilage heal. Number 1, supplements, specifically glucosamine and chondroitin. We've talked about one called Vimersin before. It's linked down in the description below. You can find it on Amazon. With glucosamine and chondroitin, it's mixed results. There's some people that improve, that they report an improvement in their arthritis, and there's some people that say there isn't an improvement at all. We just don't have a lot of solid research to say, yeah, it absolutely is going to work for you. But here's my stance on it. It doesn't hurt you. Unless you have an allergy to like shellfish, which is what this is made from a lot of times, it's not going to hurt you, and it's worth a shot. You might try it and you might benefit from it. I wouldn't rely on glucosamine and chondroitin. There's other stuff out there like MSM, Vimersin supplement that I'm talking about has MSM in it too. It might help you out. It might make you feel better, but you've got to do it with the exercising, with loosening up your quads. You can't just take supplements on their own and expect for your knee to get better. And it's also going to take some time. I mean, you need to get that stuff in your system so that it circulates enough to get to the tissues where you need it, like your knee cartilage. So it could take at least a good 2 or 3 months of taking it in order to determine its effectiveness. If you've just been taking it for a week or two, it's probably not going to make that big of a difference. Some people report improvements right away. But like I said, there's nothing consistent that shows that it helps. And we don't have enough research to say that it's something that you need to do. Otherwise, you're not going to get better. The next thing that might help is, oh, wait, I forgot one more thing that I want to harp on. Water. And this isn't a maybe. You need to be drinking more water. If you're not drinking enough water, don't count on your body healing. That's just the way that it goes. Our body has tons of water in it. And if you're relatively dehydrated, upping your water intake allows cartilage to heal much better. So just start drinking more water. As far as amounts, it varies. My advice is if you just haven't been drinking enough water, or you suspect, if you're questioning if you've been drinking enough water, go drink more water. You need to have at least a good 100 ounces in you. For liters, I think that works out to about 2.5 liters, 2 liters, something like that. But you need to up your water intake. You might go to the bathroom more. Who cares if you can avoid a knee replacement, right? You just have to drink more water. That's a healthy thing to do on many fronts, not just your knee cartilage. All right, back to the things that might help you. Weight loss. If you weigh a lot, if you're 50 plus pounds overweight, 100 or 150 pounds plus overweight, even, absolutely losing weight is probably going to make your joints feel better, especially in your knees. But it's not solving the muscle imbalance that's putting way too much pressure in your joints. So I'm not saying don't lose weight. I'm saying, yeah, lose weight, of course, for other reasons. Your heart, your risk of stroke goes down, your blood pressure, all your other organs are going to be so much healthier if you need to lose some weight. But it's not usually the number one thing that we talk to about people unless they're severely obese. Then I'm telling them, yeah, it's going to be the priority for you. You need to lose weight if you're, 70, 80 pounds overweight. But if you're like 30, 40 pounds or less, if you're at your current weight and you have knee pain, it's a muscle imbalance. You need to fix your muscle imbalance, and that's going to make your knee better. That's your priority at that time. So weight loss, it might help, it might not. It really depends. If you're just like 20, 30, 40 pounds overweight, I would not stop. I would go do the exercises that you need to be doing. Go strengthen your glutes. Go do the right things so that you can make sure that you fix the muscle imbalance. I see too many people that come into my office and they want to start therapy. They're just not. It's a commitment. You have to do exercises for a time. You have to get stronger, and they stop and they say, "Well, I'm going to go lose weight first. I need to lose 20 pounds, and the doctor told me I need to lose 20 pounds anyway for my blood pressure, so I can get off that medication. I think that'll make my knees feel better anyway." And what they're really saying is, I don't want to exercise right now. And I'm like, cool. If you're not going to exercise, I can only help you so much. Part of my treatment is you have to do exercise in order to take the pressures off. And if you're not ready to do that, come back when you're ready, and I'm happy to help you. But for 20 pounds overweight, it's not the priority. If we're talking about your knees, so you can sleep better at night and avoid having a surgery next year or sooner, maybe. Okay, the last topic here that might help you, I've touched on a bit already, regenerative medicine, which is like stem cell injections, PRP injections, the glucose injection too. Oh, I forget the name of it, where dextrose glucose, they inject sugar into your joints, and it's supposed to stimulate like a healing response, an inflammatory response. So that is it's not known to help out always. It only helps out sometimes. So you can try it out. It's typically not covered by insurance. Any of these procedures that I've talked about. If you've got the money to do it, or you want to give it a good go to be certain that you tried everything, you've exhausted all your options before going to go get cut on and having a surgery, I think it's well worth it as an option, and see if it heals you. But there isn't solid research to show that it helps you. And I would still tell people that go get it. We have people here in our clinic that do it all the time. It's not solving the root muscle imbalance. It's not making your glutes stronger. It's not making your quads looser. It's not depressurizing your joints. It is simply trying to heal the cartilage using a different method. But if the pressure's still there in your joints, and maybe you did have a good result. We see people that have good results with stem cell injections all the time, but then it comes back, and they recommend you do the stem cell injections over and over again because it only lasts so long. And I think that is because they never take the pressure off their knee joints. You get long lasting relief, which sounds like a cure to me, if you take those pressures off. That's why I say this is how you can cure hip problem, hip arthritis, knee arthritis, virtually any type of osteoarthritis. I'm not talking about psoriatic arthritis or juvenile arthritis, rheumatoid arthritis. Those are different situations. When it comes to osteoarthritis, you need to take pressures off joints. That's how they get cured. They'll scar down, and you'll lay down good, healthy scar tissue that will help you move for years to come. It is a long-term cure for arthritis. All right, I am way over time, friends. Thanks so much for joining us online. I have a red comment here. Am I in trouble? KB, good. Add Jameer. You can Google. Oh, okay. You're helping out Jameer. Thank you, or Amir. I'm sorry. Thank you so much. We'll jump back on comments here this week. Thanks so much, and we'll catch you guys in the next video. I love you guys. Bye bye.